Now, this is the last section of the animal organization and homeostasis lecture. And in this particular section, we are going to learn a lot of different terms of which explain the positions of different organs. And you will actually, these terms are used for locomotion or location or movement of different organs, and you will use them to explain how different systems are related to each other. So let's look at the first picture over here. In this picture, we are looking at an anatomical position. Firstly, what is an anatomical position? An anatomical position is when you're standing with your hand and feet. Look at the way they are shown over here. Your hands are facing forward and your feet are also pulling out. That's an anatomical position. It's important to know the anatomical position is because when you're referring to a patient, you always refer to the position of the patient's left or right. So, for example, in this particular case, this is the right of the patient. It may appear left to us, but it is, this hand is right, and this would be called as the left hand side of the patient. So keep in mind, and every time a patient is a patient's body organs or their limbs are discussed, you're always using the anatomical position. Another term that you want to get is the terms supine and or prone. Now, when you have your face open, that is, you've got a open palm, that is supine or supine, as you want to call it. And when you have you're trying to pour something down, that would be a prone position. I like to remember it this way, that this is like an open, if you open your palms, and this would be a position where you would be able to carry your soup, that would be supine, and the one that you're trying to pour would be the prone position. So let's go on with the next slide. In the next slide, we're looking at ventral and dorsal. Now, ventral and dorsal for humans is similar to ventral is actually anterior, and dorsal is also called as the posterior, and we'll talk about it in the next slide also. But which means that anterior would be the front of the person. Over here would be the ventral or the anterior, and the back would be the posterior or the dorsal. Now, in a four-legged animal, it doesn't really work that way, in the sense that anterior and ventral are not the same. For example, in the dog, when we look at it this way, then this is the dorsal, and this is the ventral side. And if I was to draw a line in the center like this, then this would be the posterior, which is the end to the tail, and this would be the anterior. So keep in mind, anterior and posterior and dorsal and ventral would be expressed the same in humans, but not in a four-legged animal, because they're not interchangeable in that situation. So, for example, the next slide is talking about anterior and posterior, and you can see why, because the anterior for the dog would be the face region, and the posterior would be the back region or the tail region. But in humans, the anterior is also the ventral side of the person, and the dorsal is the posterior side of the person. Another term we want to look at is superior and inferior, and this is often used to to express the location of a part. For example, the cap is this is the cap, and this would be called as superior to the face, because the face would then be inferior, and the cap is above the face. But if I was to look at the position of the nose versus the mouth, then the nose would be called as superior and the mouth is inferior. Or in other words, the eyes are superior to the nose. So these are again terminology that is used to relate to different organs and its positioning. Another one is important to understand is medial versus lateral. So on this particular face, if I was to draw a line in the center as shown over here, then the line in the center all the way closer to this end is called as the medial. Anything that's away from here is lateral. So for example, the ears are lateral to the nose. So the further away you are from the center is the lateral position. Another one is proximal versus distal. Proximal is closer to the body, and distal would be away from the body. Now, these two positions are usually referred to the arms and the legs. So, for example, the arms would be proximal, and for example, let's just look at these two parts. So the shoulder would be it's closer, so this would be proximal to the hand. So the further away you are, it's distal away. So the feet are distal to the knees. You may want to try a couple of different scenarios to get the feel of the term proximal and distal. Another one is superficial and deep. Deep is when is for example, if we were to dig into our skin and the muscle, so the closest you are to the bone would be deep, and the further away, that would be anything that is more closer to the skin, would be called as superficial. So this is going to be away from the body, and deep would be closer to the body or to the inside. Another one are these three planes, and these three planes are imaginary planes. So, for example, if the first one we want to look at is the sagittal plane, and the sagittal plane is if we were to look at this particular, let me just draw it over here, this particular line over here. And or I can actually, I'm going to go ahead and draw a person over here. I'm not very good in drawing, but anyways, if this is the person, and if we were to do a position right in the center, let me change the color. If I was to cut it this way, this would be called as a mid-sagittal. And if we were to be on one other side, which is unequal distribution, then that is called as the parasagittal. So this would be the parasagittal, and this would be the mid-sagittal, and they're both dividing left to right. Okay. Another one we want to look at is a frontal position. Frontal will usually divide anterior and posterior for humans. For example, this would be the frontal plane. So when you divide the body with the frontal, you will have the front, which would be the anterior, and then you would have the back, which is the posterior. So this would be, let's just write it down over here. When we're dividing this, you will have anterior, and you would have the back, which is posterior. So a frontal plane will always divide. The reason we're learning is because when we look at different tissues and organs, and we're trying to see different segments of different slides, these terms will then start making sense to you. Another one is transverse. A transverse is going to be a position which will be which will give you, for example, let's do it over here. So this is the transverse cut. Usually it will be like a cross section. You will always get the top part, which is the superior, and the bottom part, which is the inferior. So you have superior or inferior when you do a transverse section. Let's talk about a little bit about the body cavities. We did mention earlier, I did mention to you that there are two different body cavities, the dorsal body cavity and the ventral. And in the dorsal body cavity, which is the smaller one, includes the cranial cavity and the vertebral cavity. The cranial cavity would include the cranium, which is the brain, and all the membranes and different nerve fibers and all the stuff inside it. The vertebral cavity would include the vertebral column and all the nerves that are inside it. So these the body cavities are lined with a membrane, and I will mention it to you in a little while, and then we'll come back to this slide to look at those membranes. However, the ventral body cavity is going to be is actually divided into the superior and inferior, which is the diaphragm is dividing. Here is the diaphragm, and the diaphragm is actually it has this thoracic cavity, which is superior, and then you would have the digestive cavity, or the other cavities that will be, or all the organs which are going to be inferior. Let's see, what do I need to tell you over here? I'm trying to remember. I want to go back on this slide over here and mention that the body cavities are lined by meninges, and let's come back to this slide over here. Meninges is like, it's a connective tissue, and it lines the brain and the spinal cord. So the entire dorsal body cavity, which would be all the way from here and all the way down there, and then coming back this way, is going to be lined by the meninges. It's a kind of connective tissue, and it lines the dorsal body cavity. The ventral body cavity is also lined, and the ventral body cavity is lined by what we call as the serous membrane. The serous membrane is it's like a protective coating that's present all over the organ, whether you have a heart or the lungs or the bladder. And this membrane has no outside opening. And the purpose for that, it is protecting and covering the organs. So the serous membrane actually has two parts. The outer part is called as the parietal layer, and the inner part is called as a visceral layer. In between the two layers is a fluid, and this fluid is called as the serous fluid. Now, this fluid is a very good lubricant, and it reduces friction. For example, the heart is constantly beating, and it will cause a lot of friction to the ribs, and to avoid that friction, the serous fluid lubricates the mechanism. Same thing with the lungs. So the serous fluid is a lubricant for within the serous membranes. Another thing that the serous membrane does is that it sort of compartmentalizes the organs. So compartmentalization. It compartmentalizes the organs. So, for example, if you get infected on your lungs, then your lungs will have a serous membrane which will protect it. So the bacteria will not transfer to other parts of the respiratory system. The serous membrane that covers the heart is called as the pericardium. The serous membrane, let's see, this is the one that covers the heart. Pleura is the one that covers the lungs, and the abdominal pelvic is covered by peritoneum, and that is, for example, your stomach and your intestines, and all those linings that are present within the digestive system would be the peritoneum lining. We're almost at the end. We have couple of more slides. I think we have one more slide after this. And the last kind of membrane is present in those cavities that are open to the environment. For example, the digestive cavity has an opening. We have the mouth and the anus. So you have an external opening, and this cavity is lined by a mucous membrane. A mucous membrane is a very sticky fluid, and this sticky fluid has the tendency to trap dust, fungal spores, and different particles. And it's a good immune mechanism to have a mucous membrane. Looking at this picture, you can see that another cavity that would have mucous membrane would be the nasal passage. So some of the terms that we learned in this chapter are very important, because in the next section that you plan to take, which is the 201, 202, this particular chapter will be definitely used a lot. So you may want to review these terms before you start anatomy and physiology next semester.